Welcome, everyone. Eric Rice is out of town. I said I was happy to introduce myself as part of the ongoing research series that we've been doing here every Tuesday at noon. Glad to see so many people here and online. Today, I was going to talk about a randomized control trial that we're doing right now about a social support and basic income intervention. It's ongoing, although data collection is done. My understanding that these are pretty informal. So I do have some slides and I do have some results. These are initial results that we can go over today, but I also just wanted to kind of talk through the project so you're clear on what it is, how it came about, answer any questions you have, and also just, maybe get your input to help me understand some of the results that we're seeing, because they're not what I expected, and so it's trying to make sense of all of that. So anyway, we decided to do a randomized control trial with a community partner known as Miracle Messages that some of you may know, but it's a nonprofit up in the Bay Area, and I'll just give you a little bit of background on them. They're a program that was started by an individual named Kevin Adler. He's very open about his own experience, having an uncle who experienced homelessness and had suffered from schizophrenia. But he was very close to him, and he was, quite saddened to see how things turned out for his uncle, and really wanted to try to do something to kind of address the isolation and the loneliness that people who are unsheltered experience on a daily basis. And so he started this nonprofit basically initially to try to help people reconnect with family who have been out on the streets for years. And he did this by getting volunteers who would volunteer to sort of act as private investigators and track down if people's families, if they were interested, and try to make that reunion. And so that was a program that had been going on for a few years until the pandemic hit. And they had to pivot a little bit, and they came up with a program because they had lots of volunteers who were interested. How can I help? And so they started a program known as Miracle Friends. And that was where they would do outreach, and they would try to, if people were interested in being connected to a phone buddy program. So housed volunteers would be matched with unhoused individuals. They'd have to have a phone. And the goal of this program was just to have somebody to talk to, and to try to address again that what Kevin talks about as social poverty, but otherwise you might think of as social isolation or loneliness. And so they had this a lot of volunteers coming into their organization, and they were matching a lot of people. And what they noticed was that it was supposed to really just be about that relationship. They weren't asking volunteers to dip into their pockets to offer material resources. In some cases, volunteers might be in another country, another state, so people didn't even always have the chance to meet up. But they were aware that, often they get requests from their volunteers about, their friend needing some sort of resources, money for a bus ticket to go visit family over the holidays, whatever it might be. And they really wanted to try to preserve the relationship, and said, we should have a fund of our own where if there are these requests, people can make them to us and we can help facilitate that. And that way you can kind of just focus on that relationship and not have it be an exchange of sorts. So that's kind of how money got introduced into their program, and them distributing money. But they got to a point where they're like, yeah, why aren't we just giving out money? Like, why don't we raise money and give out? This idea of guaranteed basic income has become quite popular, and there's pretty convincing evidence in international studies that it really can be transformational. There have been studies that have lasted a decade or longer, and you really see that providing basic income has a lot of positive outcomes as one could imagine. But there hasn't been too much work done on providing basic income to vulnerable populations, let alone people experiencing homelessness. And so you can imagine that there's a whole set of concerns that people have around this idea of whether, if you're in a homeless situation, is the money going to help? I think the biggest concern is, are people going to use it on drugs? Is there going to be increased risk? All these kinds of things that we sort of stigmatize. It's just, there are other considerations that come up when thinking about this population. But nevertheless, they move forward. They raised enough money to have a small pilot program of what they call their Miracle Money program. So these are people that are connected to a friend, and then their friend can nominate them to say, yeah, I think this person would benefit from basic income. And they did a selection process, and they were able to distribute $500 to, I think it was 12 or 13 people over a 6-month period. And what they found is that most of those people actually exited homelessness during that time period. And so now granted, that was a small number of people, they were hand selected, but they were pretty convinced that this was a program that worked and worked well to address homelessness. And so,
yeah, in San Francisco or all over the place?
This was in San Francisco, people in San Francisco. Yeah. And by the way, if you go to the Miracle Messages website and you want to see some stories about people reuniting with their family, if you are open to have some tears shed on some of these stories, they're really quite moving, and they highlight some of the pilot work that they did on basic income as well. But we talked about, look, this does seem pretty convincing, and I get intuitively why it would work, but you don't actually know unless you have some sort of experimental design where some people get money and some people don't. And that started us on this journey of how would you design a study to look at that? And the other thing is, they hadn't really done any evaluation work just on the Miracle Friend program, on this like matching people in relationships. So they had no sense of, they had a feeling that the program worked and it worked well, but they had no data, right, about to what extent it reduced loneliness and addressed social isolation. And so this was a lot to solve for. Sorry, if there are questions, just chime in. I just hear a little feedback, but and also I can see if you raise your hand, I think I can see it too. So let me know. Sorry, I'll continue with the story, and we'll get to like all the good research stuff soon too. But right, so part of what we had to figure out is they wanted to evaluate their Miracle Friends program. They also wanted to evaluate their Miracle Money program. They wanted to do it in a way that you had a control group, right, so that you could actually see the impact that the programs were having. And they didn't want to, right, they didn't want to adjust their program such that people were signing up for the Miracle Friend program just because they wanted money, right? That's not the way they started. They really wanted to do sort of a clean evaluation of the Miracle Friends program. So the design we came up with was that, look, why don't you go ahead and recruit people into your Miracle Friends program, and we won't mention the Miracle Money exists, but when people enter, we'll just explain to people that if they are interested in Miracle Friends and they're willing to sign up for a study to look at its effectiveness, they can enroll in our study, and then they'll be randomized to either get a friend or not get a friend. And that's kind of what was presented to people during this phase. And so most people were okay with that because they just heard about this program, and so maybe they really wanted a friend. Then they had the option to just get assigned a friend and not be part of the study. But if they were open to the randomization, then they would enroll, and they knew that they had a 2 out of 3 chance of being assigned a friend. And the reason they had a 2 out of 3 chance of being assigned a friend is because every other person who was assigned a friend was also assigned to the Miracle Money arm. So we actually had 3 arms that we didn't disclose. So there's a little bit of deceit going on here that, again, had to go through the IRB and explain, yes, we are not being fully transparent on our consent form. These are the reasons why. And we explain that all. So that was a first for me to actually have that as part of the research process. But so the plan was to enroll people, and then as they got matched with their friend, if it was a successful match, then they would be notified if they were in that third arm that they would also be receiving monthly payments of $750 a month for a year. Okay, so we increased the payment from the pilot. It had been 500, it went to 750, went from 6 months to a year. And we were fortunate enough there was a private donor who was interested in this. Was there a question, Mahal, or? Oh, no, sorry. There was a private donor who was interested in this idea. They funded the study so we could for it. Sorry, I'm just gonna mute people if that's okay. Okay. And so there was a private donor who funded for about 50 people here in LA. And then Google.org was willing to expand it to have the study done in San Francisco as well. So at the end of the day, we had enough money so that about 105 people would be able to get this money for a year. And so, in an ideal world, we would have enrolled 315 people into the study, and they would have been randomized, and 105 would have gotten them in the money bucket, 105 just the friend only, and then a waitlist control, waitlist being for the Miracle program. So that's how we designed the study. I'll get into the slides now to kind of let you know how things actually went, and tell you about what our initial findings are looking like at this point. And this is, I should just say also, this is a mixed method study. There's some folks here, actually Olga and others, who helped with the data collection, which was challenging because these were people, again, that were recruited from tiny home villages or drop-in centers or whatever. And so just kind of keeping track of these individuals was not easy. And so let me just share the slides to get on to. Okay, can everyone see these? I'll try to show these slides, or that's probably okay, right? I can just leave it as is. Okay, so what I kind of just wanted to quickly go over and leave plenty of time for questions is how we ended up with our sample, and then look at some of these initial outcomes, right? And so this is our consort diagram. So the idea of just enrolling 315 people didn't work. Where we ended recruitment was when we got enough people who were randomized into the Miracle Money program, and that they connected with their friend, and that they then were told they were getting money. And so we just kept recruiting until we had basically 105 people in that arm. But as you can see, we lost a lot of people along the way. So we actually, had to recruit over double that amount of people. So ultimately, we recruited 760 people. You can see the breakdown of the different control. That's Miracle Money and Miracle Friends, pretty evenly distributed. At the end, what we call, received treatment is, again, this sort of goes to, we just kept going until we got close to 105, and then we stopped. And so the received treatment, the control group is just a control. There is no treatment, so that's why it's all 237 people. The Miracle Money folks are, we kept going. Again, we lose people, attrition along the way, but this was until these people were matched with a friend and then told about the money. And then ultimately, we wanted to track people over time and compare them. And so you can see there's a little bit of attrition even from the 103 people that got the money. We were able to keep, close to 90% of those folks in, 88 at the end. And that's so this is really our analytic sample. What you might notice is the small number in the Miracle Friend program. And I think this was pretty illustrative, that while I do think to some extent this is a very beneficial program to those where it's a good fit, there are a lot of people who, while it sounded like a good idea, just weren't in a place where they could be matched with a phone buddy, establish a relationship and stick with that relationship. And so I think they were kind of surprised at how many people sort of expressed interest, but in the end wouldn't follow through with that. And I think part of the difference you're seeing, in theory, everyone in the Miracle Money bucket first had a successful match with their friend, but the definition of being successfully matched with a friend, I would say, deteriorated over time a little bit. In the beginning, it was like, oh no, this person needed 2 or 3 contacts with their friend before they were in the program, to if they made a phone connection, let's consider them successful and give them the money, right? Because I think we wanted to get this money out the door. And so I in some ways, this isn't a great representation of the program the way they imagined it. But to some extent, what you do have is a sample of people who really did connect with a friend, and people who connected with a friend may or may not have stuck with their friend, but did get the money. Okay, so anyway, did that make sense? Or yeah.
So does the participant have to connect with a friend to get the money?
Yeah, so that was right. This was not, so to be clear, this was not, we didn't go in saying we want to look at the effects of basic income on homelessness, right? It was really, there are some studies that have looked at that. This was really about the idea of the Miracle Money program, which is you're connected with a friend and then you get money on top of it. So we don't have a group that just got money and right with no friend attached. So it's a little different. Anyway, so this is our final analytic sample of 88 people that we followed. Yeah.
Sorry, could you explain if the MF and the MS are they overlapping or non-overlapping?
So the MF represents people who said, yes, I want a friend, and were assigned to the group who would only get a friend.
Okay.
The M money are people who said, yes, I want a friend, were assigned a friend, and then surprise, they were told you're getting monthly payments for a year.
Okay.
So again, we didn't disclose that until they actually connected with a friend, and then the program called them and said, you were randomly selected to get this money. And so that's how that happened. Okay, so just a couple quick things, and then we'll look at the results and field any questions. But and let me just see if there are, I see some chat. There are questions in their chat. It's a little hard. Well, come off mute if there are questions, because it's hard for me to navigate that. The money, right? So how did that work? It basically, once someone made that connection with a friend, the program, Miracle Messages, set up a call with the friend and the individual, the volunteer, and together notified them that, you were randomly selected to receive this money. I think only one person turned it down because they were worried about its impact on benefits. Everyone else, even if they had benefits, and about a third of our sample had some form of disability benefits, SSI or SSDI. But, they, to some extent, they were told that this was not considered actual income that they needed to declare. There was a lot of back and forth about that. And the Miracle Messages looked into waivers for things like food stamps and other things that could be affected if they got this money. So for the most part, it shouldn't have affected people's benefits, although there was some risk and one person did turn that down. But essentially people had to sign up. If they had a bank account, then they would complete an application to get a direct deposit if they wanted. A lot of people did not have a bank account, and so they had to complete some paperwork to get basically a debit card that would be, refilled each month. And then they could use that, they could actually withdraw cash, or they could use that for purchases. And any of the transactions that they use, we have a record of that, that we need to look at. So now the design of this was essentially, we recruited people into the study, so that's their baseline. And then we would interview them quarterly, so every 3 months, for 5 follow-ups, right? So a 15-month period. And the reason we did the 15-month period is because we thought they'd enroll, they needed to get matched, get the money, and then we wanted to follow them for the full year that they got the money. So we should have, baseline through Q5. Those are our assessment points. And everyone got the same questions. So we looked at, we had measures of loneliness, social support. We talked about like meeting basic needs. We looked at mental health outcomes, these types of things. We also asked in our substance abuse module, so to speak, there's a question about how much money you use on cigarettes or drugs and alcohol, quote unquote, temptation goods. That's one way you can assess people's substance use. So that all those questions were asked of all groups, like nobody got sort of different set of questions. And then there were some open-ended responses about, what's changed the past 3 months, what are your goals, these types of things. The only extra data collection that the people in the Miracle Money group got is, yes, we do have access to their actual transactions from Aid Kit, which was a group that was brought in to do the cash distribution. And we did qualitative interviews with about 20 people shortly after they were told about the money. And so we've already looked at those, and we have a manuscript under review about that sort of initial shock and expectation. And since then, we did follow-ups with most of them at the end of the year and added about 9 or 10 people. So they're closer to 30 people that got, let's call it the exit qualitative interview. And I was just reading over those last night to try to make a little bit more sense about this. Okay, so let's, with all that lead up, I will get to, we don't have to get too into this, but this is just showing that the average, and by the way, for these purposes, we're dropping the Miracle Friends group for right now, that small group. There's a lot of attrition, differential attrition. It's going to be complicated. I'm not sure exactly how to handle that, but we will look at the 103 people that really went down to 88 in our analytic sample that got the money versus our control group, right? So in the end, we had, if you look at baseline and that kind of Q5, we had 106 people in our comparison group and 88 in our experimental group. You can look at the mean days in the study were pretty similar, 457 and 455. I will say that randomization worked really well. When you looked initially, there were no differences between the groups. Once you started funneling down into these smaller groups, we did see differences in education level. So that people in the Miracle Money group tend to have higher levels of education than the control group. But otherwise, there weren't really differences we saw even with that attrition between those two groups. So again, pretty comparable groups and in the study for comparable amounts of time, which is really important because, again, one of our main research questions was, will this money result in higher rates of exits from homelessness, right? So will it help people get out of being homeless? Because that was part of the criteria for being recruited into the study. And then also, would it address like loneliness and isolation? Those were kind of our two main outcomes that we wanted to look at. And of course, not really a main outcome for us, so to speak, but this question of whether it would have a negative impact on substance use was one that we knew we were going to get. And so that's also something we wanted to look at today. So let's go to trends in, okay, so exiting homelessness. This is a little tricky. So, when you talk to someone and say, what's your living situation? That's not always a very clean question, right? Because it might be that, well, today I'm staying with a friend and tomorrow I might be in a shelter and then I might sleep in my car. So we asked a question about, where are all the places you stayed in the past 30 days? We did this at baseline. And then if there was more than one place, where did you spend most of your time? And we had, responses like in a vehicle, on the streets, in a tent. We also had another person's house at my own place, right? And so what we were looking here is just like, okay, where did they spend most of their time during the past 30 days? So you can see that at baseline, we only had about 12% of the people in the control group and only 7% of the people said they had kind of they spent most of their time not homeless, right? So that means either they report being in their own place or someone else's place, but not a selection of homelessness. And at follow-up, what's great is over half the people, were no longer reported being homeless or at least spending most of their time homeless. That's true, but that's true of both groups, right? And so what this really tells you is like how, unstable to some extent people's living situations can be, but that time is really a huge factor in this. In other words, at the start, everyone's reporting spending some time homeless, but as soon as you say go, people start resolving, right? And they find alternative living arrangements. And so it was true in both cases. We thought these differences were going to be just a little bit higher in the Miracle Money group, and they are, given that, the gap between 7 and 55 and 12 and 49, there is some difference there, but it's not significant. Again, this is not a huge sample, but that was not a significant finding. So at least the answer to this is it does not look like the money helped people better resolve their homeless situation during the course of this year. Okay, so that's important. The next thing, what about trends in loneliness? As you can see there, it's pretty flat, right? So over half the people sort of reported being what you would consider on the loneliness scale, lonely, and that really didn't change over the course of the year for either group. So we didn't see any differences there too, and we didn't see much movement in that. Okay, well, maybe it's not going to change people's living situation, but they're going to feel more secure. A lot of people actually did report spending their money on things like basics like food and clothing and things like that. And so when you look at the food security, you can see that it looks like our control group got more food insecure over time, and our other group kind of stayed stable. But again, they didn't improve necessarily in being more food secure over that period of time. And lastly, so we did have one significant finding, and that was in terms of self-reported mental health. And people who got money at the end of the year reported worse mental health than the people who did not get money. So go figure. And I won't get into this was seeing a healthcare provider. That was also significant, but doesn't make a lot of sense either. And then, look, this is an interesting finding. Again, it's a null finding, which no one ever likes to report, but this is any drug use in the past month. And, as you can see, getting money didn't really lead to people using a lot more substances, right? And so that's like a question you get, and that's kind of what's reflected in this. So, again, these are preliminary findings. Himal Suttar, who's a PhD in biostats here at USC, helped with all of this, did all of this along with Amanda, who's online here. So I'm gonna stop sharing so I can see people again. I just wanted to, run through those findings. I do have to say, it's not what we were expecting, and it is to some extent, it's in sharp contrast to the qualitative interviews, where when you ask people like, what impact did this money have, or the miracle friend, you do get a pretty strong reaction that it had a positive impact on their lives. But it's really not coming across in our quantitative outcomes. We're not seeing that in our measures. And so that's kind of where we are. I have more to say, but I figure I'll just stop and get some reaction. Yeah, Sam.
Could this be maybe representative that the real solution to homelessness is housing first? Because the money wasn't enough to get your own place, right?
Right.
I'm looking for positives.
Yeah. So that's a great question. And I think, look, to me, it's sort of like, how did I end up doing this? Right. And I've done a lot of work that's looked at, to your point, if you provide access to housing with support services, it's pretty effective at addressing homelessness. when I heard this, I'm like, this is kind of similar, the same thing. You're giving people access to resources, you're giving them a friend. You know, if you squint your eyes, it's maybe not that different. And so I was pretty excited about the potential here. I think to your question though, and this is what we went back to Miracle Messages was, you know, what was the actual theory of change here? Because to your point, $750 a month was not going to allow someone to go out and rent an apartment, right? So how was that supposed to turn into people getting, you know, out of homelessness? Now since then, you know, I've tried to make sense of that on my own because the program was just like our pilot worked. It must work. We don't need to think beyond that. But I think they're thinking about that. I'm thinking about that. And what we sort of expected was that, you know, most people falling into homelessness are not doing so from a leaseholding situation, meaning like they've got an apartment and then something happens and they're out on the streets. Most people are coming from informal housing situations where they're paying nothing or very little in rent. They're kind of contributing and then something happens and then they end up homeless. And so I think there was one theory change here was supposed to be this wasn't enough money to rent an apartment, but it might be enough money to open up other options that maybe are not ideal, but better than being on the street. So, and the truth is, like, we did see that play out with some people, but clearly across the board, that wasn't. I mean, I think the other theory of change was this money was somehow going to help people. And we did see this in the qualitative where someone like, oh, I'm going to go get a bike. I'm going to like then start delivering food, right? It like might lead to somehow increased income that would get you out of homelessness. But again, this is not, we didn't say what's the median rent. I don't know, what is it now? 2,200 for a 1-bedroom or something. So we didn't say, hey, we're going to give you $3,000 a month that will cover rent and plus let's see if it works, right? That would have been a different, that's probably not a bad idea, but right, that's not what we did, yeah.
The Department of Mental Health has a program called HERE program, and it's like a buddy, a friend of a person who's actually getting paid to become a friend of the homeless person, and he helping get back in the feet, giving resources and being a support there because loneliness actually is a big factor, especially people who actually leave the home because of domestic violence, whatever. They don't know what happened and they don't want to go back to home. You know what I mean? So I seen out there a huge percentage just don't want to go anywhere really. They just want to isolate. And this peer program, I think it's very effective. I mean, the homeless person don't get any money, but at least they have a buddy, somebody actually can help them, navigate resources, get back in the field. Yeah, I noticed that. Are you aware of it? Do you know?
Yeah,
It's
so I mean,
similar.
I think, I get the sense that the question's really around like the Miracle Friend program itself and how effective is that program right, in terms of kind of establishing these relationships, which is in some ways sort of a peer model. And, again, if you go to the website and you see some of these relationships that develop, I mean, it will melt your heart. I mean, it's quite moving when it works. And, I signed up, I was a Miracle Friend before this all started, just so I could understand more. And, I didn't quite have that connection with my person. We talked for 6 to 8 months, usually weekly, every other week. And, I think, I don't know, maybe I was like being too much of a social worker and trying to like listen and stuff, I think ideally it's got all the awkwardness of a, establishing a human relationship and a friendship. And I think for some people it works really well. And there are a lot of people though that when, like last night when I was reading the qualitative, people had 2 or 3 friends during the year. They got matched several times, they thought well of their friend, but they didn't necessarily rely on that. So I think sometimes it worked really well and sometimes it didn't. I think everyone was appreciative of the effort. I didn't read anything where people were like, these people are annoying me or about it. There was nothing like that. But sometimes it just kind of didn't stick. I know, like, for instance, like the VA was very interested in like a more clean peer model of what if we had vets helping unhoused vets, you know, and establishing those relationships. And so there's been some conversations there. So, you know, the way they did it is they just try to find mutual interests. So this one guy last night, you know, he was in his 70s and his friend was 19. And, you know, but they both enjoyed chess and they talked about that. And that's how they, you know, that was like what their relationship was built on. So, yeah. So, you know, we'll have to look at that. But again, we only had 44 people, I think, in the end in that group that were successfully matched that we can look at to see their impact.
You know, I'm experiencing homelessness right now. And, you know, even though I'm still married with a US citizen, I don't have my green card anymore. So I don't qualify for, you know, benefits.
Mhm.
So that makes it much harder for me to, because, you know, you're like chasing your tail just to get food, you know, and be safe. But there's this program called Flex Card.
Mhm.
Also, that provides $400 a month. And that, but that's only for a specific demographic, people who have HIV.
Yeah.
We're saying now.
Yeah.
For HIPAA. But it's people who do not qualify for benefits, you know,
Yeah.
like my case. So this is tremendously helpful. I mean, it's amazing.
Yeah.
I have to say.
Yeah, I mean, your point is well taken. I think that disconnect that I was talking about in the qualitative is that you really did get the sense that this money brought a lot of relief to people, and helped them in many ways that's hard to quantify. But it also didn't change their lives. Like, I think at the end of the day, you know, like we talked to them at the end of the year and it was like, it's great. It helped me. Like at the end of the month, I wasn't bugging like, you know, my family for money. I wasn't doing this, but they knew it was going to end. Right. And it wasn't transformational money and it was time limited. And so, you know, to some extent, I think maybe that is what's being reflected here is that it probably does a lot of good while people are receiving it. But it doesn't quite position them to, you know, go beyond the 12 months and completely change their lives. So. Mahal. Yes, Mahal.
Yeah, first of all, apologies for the call in the middle of I forgot to mute myself.
worries.
I may have missed it, but were the meetings in person or virtually? That's one question, because I looked online and it looks like the meetings were virtual. So that's one question. And the second one, Devon here online made a comment that I think is important, whether there was any financial literacy education about the money that was attached to the miracle friendships.
Yeah. Yeah, both good questions. Oh, can I unmute myself? So, I mean, these were supposed to be virtual, you know, it was a phone buddy program. And so the connections were supposed to be, you know, a lot of like, even when I was doing it, you know, you might just text the person or you'd have phone calls. I think for some people, you do end up meeting, you know, your friend and having lunch and those sorts of things. For some, that's not possible because they're matched in different states and things like that. So I think the intention was that it was really supposed to be virtual, but that didn't apply across the board. So that's that one. I think we did ask about financial literacy, and I know early on there was some idea that there would be an option for people to get financial literacy support, but in the end, that was not something that was offered, and people did not report that they received any kind of support in that way. And that just sort of reminded me too. In fact, you know, as far as I know, like most everyone we talked to didn't disclose to anyone that they got this money. You know, it wasn't like, hey, I won the lottery. I mean, they were very protective. They knew they had that. The other thing that comes across in the qualitative interviews is that people were quite generous with this money, right? So once they had the money in their pocket, if they, you know, had a friend on the street or even like kids or parents, like they were pretty generous in terms of supporting others, but they still didn't tell them like where the money came from or that they got this money. So there was a kind of a protective instinct in that way. Another question online?
Tracy had one.
Yeah.
Tracy, do you come up?
Hi, thank you for acknowledging me. And I'm so excited to hear about this research because there are so many similarities with mine. And my thoughts are, how could we partner? Because with loneliness being an epidemic, and I am here in DC today, and the Surgeon General is speaking on Thursday on the epidemic of loneliness, is my first question to you. And how can we mimic that in nursing? For example, we know that loneliness is linked to chronic diseases. And there was a pilot study in Houston that linked student nurses to individuals within the community, not necessarily homeless individuals who were homeless, but individuals who identified as being lonely. So how could we mimic something similar and offer incentives to partner individuals and to really mitigate risk factors for chronic disease?
Mhm. Yeah, Tracy, it's a great, I mean, it's a great point, and I think you're right. I think that the Surgeon General's report really brought this to light in a way that I don't think people were talking about before. And you know, and so I think again, what's challenging here is often you want your intervention to fit really well, like right with the population. And I think again, this is all ongoing, so it's like I don't want to make conclusive statements, but I think that this was very challenging when you actually went out to try to recruit people into a phone buddy program, right? And for some, it clearly had some amazing results. And again, on the website, you can look at some of those. But it's not a great fit for everybody. Like for me, though, when I think of all the people that are moving into permanent supportive housing who are more stable, but like totally isolated and protecting and staying in their apartments, all of a sudden the phone buddy program seems to make a bit more sense to me in that context. And so I do think that, and again, I mentioned how the veterans were kind of interested, in the VA was interested this for veterans. I mean, I think this is a great idea. I don't know, you know, again, we have a small sample, so we'll take a look at the impact that just the Miracle Friend program had. But, you know, I think that this provided some preliminary data for the program on how they could make some changes. But I think to me, it just kind of highlighted that this is a potentially useful intervention, but maybe in different contexts.
I agree, and thank you for that information. I do think that using a team-based approach and piloting it in a specific group of individuals, I think it could really provide some good feedback for additional, you know, for longitudinal and for larger studies as well. So thank you for sharing.
Yeah. Yeah, sure. And Frank, I know you have your hand up. I just wanted to add to, I mean, I think what was also just personally useful about this is, you know, so much of the quote unquote support services we offer people, it's like navigation, right? It's like it's kind of providing a service, and we know how much relationships matter, right? I mean, like we teach that in our classes, and that's really important. And I think sometimes people lose that, and it's not often reflected in the services that people receive. And so, you know, this in some ways just kind of reminded me of like what it would really mean to sort of be a caring partner when you're trying to assist somebody. And so, you know, at least these friends are volunteering just to do that. And it's not a clinical model, but it's a therapeutic model in that way. And so that I think that's just, you know, useful. I just kind of want to point that out. Frank, you had your hand up.
We're at 45 minutes, so
Oh, okay.
time is up. Your time is up. And questions I have, I'll go ahead and send them to you by email, but
Please do.
during your conversation, you mentioned the fact that you reverted back to your referral, a behavior of being a social worker. Good for you.
Thank you. Thank you.
Social worker first, everything else second. Good for you.
Yeah. And I appreciate you being our timekeeper as well. I don't want to keep everyone. These are supposed to be short. I think we end at 4:45, and since Eric's not here, I'm just gonna bring us to the conclusion. Thank everyone for being here. If you have questions, by all means, you can stay after, email me. Happy to keep talking. But thanks so much.
Thank you.